I invite Dr. Nandakishore Dukkipati from Hyderabad. He works in Livlife Hospital in Hyderabad, and he's a bariatric surgeon. I think he'll be speaking about obesity and problems in the elderly.
Thank you, ma'am. Good afternoon, everyone, and Dr. Sundari, ma'am, and organizers, I thank you all for having me here. It's a great pleasure to be here, to be a part of the second World Congress on Gerontology and Geriatrics. So as a bariatric surgeon, we happen to take care of people from different ages. We take care of people from age 13 onwards all the way to age 70 with multiple medical issues, one of the major ones being obesity and the multiple issues that occur because of obesity.
Just 1 minute. This is a slight change in the program because I think he has to catch a flight. So organizers asked me to invite him first rather than Dr. Jacob. Dr. Jacob will be speaking next. I suppose, is it okay with him?
I thank the doctor and the organizers for doing this for me. I appreciate that. And I request the audience to bear with me. So I bring you greetings from Livlife Hospitals. That's what we run in Hyderabad. And we're also present in multiple other cities, mainly taking care of obesity and other related issues. So today we're going to speak about obesity in elderly, or the politically correct word should be senior citizens. Personally myself, I've been involved in bariatrics for the last decade, since 2002. And had a privilege of taking care of close to 5,000 patients till date. And many of them happen to be overweight, and many of them happen to be older rather than elderly people. Here is one of the people that I bring to you with one of the testimonials, so you can just hear his thoughts. He's just 1 week out of surgery. Okay. As we fix the technical issues, we'll just move on to the next one. Okay. So obesity is because of many reasons. We know that the consumption of food, one of the major issues today, availability of abundance of food, and mostly fast food and high calorie food material today is the main reason for this one. Along with that, lack of physical activity. How many of us are guilty of doing this? I am. Anyone join me on this one? Right? Okay, especially IPL, forget it. We're there on the sofa, right? And also this, we have the highly fried, oily food material, although it tastes very good, I'll tell you that, but it's really not good for health. But these are all the reasons that are contributing to our excess weight gain. And as we get elderly, there are a lot of changes that happen in the body, right? Along with that, if you look at I frequently fly to different places, and this is what commonly I see this. One side you have an escalator, one side you have staircase. And you can just see how many people are on the escalator versus the staircase. Meaning when given a choice, people will always take the easiest way out. They will never overexert themselves. So needless to say, 60% of the world's population today does not get enough exercise. So what is obesity, right? If you have about body weight more than 20% of your ideal body weight, or you can also consider it in the form of body fat content. If you have higher body fat content above a certain level, you can be considered as obese. One of the common measures we use is called body mass index. It is not perfect, but it holds true for almost 95% of the people. What is body mass index? Basically depends on your height and weight. Your height in kilograms divided by your height in meters square. Right? Once you do that, you get a particular number. And you don't even need to know the formula. You can get onto the internet. There are so many calculators on the internet. You can plug in your height and weight and gives you the number. So the ideal body mass index for Indians is 18 to 23. If you cross body mass index of 30 in international data, it is considered to be obese. But the latest Asia Pacific guidelines suggest that if your body mass index above 28 for Indians, you are considered obese. Now ask me why. Asia Pacific zone, Indians, Bangladeshis, Pakistanis, all these our side, we have higher body fat composition compared to a Caucasian adult man. If you take an 80 kilo white American person versus a 80 kilo Indian person, we will have substantially higher body fat content compared to other people. So that's why we have a higher risk of attracting many health conditions at a very low, much lower body mass index. Okay? So, obesity in India, where I come from, Andhra Pradesh, we rank 5. Yay. So, we are ranked 5 in the country in obesity. First spot is taken by Punjab. Karnataka is nowhere in the picture. Yeah, very poor, very poor. But I'll tell you, as a city, Bengaluru is ranking 5. Okay? Don't go too far now. So, let's talk about the pertinent things. Obesity in elderly or senior citizens. See, our population is aging rapidly. We are a service industry based country. Today, India is succeeding in many fronts because we have workforce that is young, talented, energetic, and relatively healthy. But then you throw in a little bit of Western components: pizza, burger, pub and club culture. Now what happened? Now you have the same enthusiastic, young, energetic workforce gain weight. Once they gain weight, they become lazy, productivity comes down, they fall sick more often, there are more sick days, less amount of work achieved. End of the day, China will beat India in service also, right? So this is what is going to happen, and as elderly we get, the metabolic rate also starts cooperating with us a little less. We'll see that in a little second. So one of the major issues with obesity is that having more of intra-abdominal fat. There are two kinds of body habitus. One is apple shape, one is pear shape. I'm sure most of you all know that already, right? Apple is right here at the tummy, big fat tummy. Pear is more of the fat at the hips. In this particular scenario, pear is better than apple. Although everybody says an apple a day is good and keeps the doctor away, but still, apple is bad in this situation because you have the abdominal fat, the visceral fat which is there inside the abdomen. It is metabolically active. It can produce a lot of funny things. Cytokine, C-reactive protein, you name it, a lot of different active metabolites that can really tackle a bunch of organs in your system and create what we call as a metabolic syndrome, and gives you a whole bunch of situations like type 2 diabetes, blood pressure, cholesterol, leads you to strokes, heart attacks, and many other conditions. If you look at it, obesity today can be one of the primary cause for 53 different conditions in a human body. Okay? Also, what we are seeing is that body mass index may not be an accurate number in elderly population. We're also looking at the waist circumference and waist-hip ratio. It's interesting to see that if you look at the data from 1998 to 2008, on an average, both men and women gain the waist circumference by 5 to 10 centimeters. Okay, now that's a big jump, right? Imagine, you can always size the pants down, but imagine having to size them up. It's difficult, right? So anyway, the complications of obesity, if you look at it from head to toe, it can be migraines to cataracts to strokes, heart disease, diabetes, type 2 diabetes, hypertension, cholesterol, fatty liver, pancreatitis, multiple cancers, gout, all the weight-bearing joints can get into, because obesity can get worn out. You have knee pains and back pains. Young ladies, let's go back to the younger age group, have irregular menstrual cycles, infertility, PCOD, you name it. Every single system in the body can get affected if there's more fat in the system. Now what about elderly? In elderly, what we see is that there's a reduced function and decreased quality of life, right? With type 2 diabetes, arthritis, vascular disorders. What I mean by vascular disorders, wherever the blood is supplying, you have problem. Blood is supplying the heart, if it gets blocked, you get a heart attack. Blood is supplying the brain, you get a block, you get a stroke. So like that. And also you can have peripheral vascular diseases, meaning the blood vessels that are supplying to your legs can get clogged. So then you have problems with that. If you're a smoker, that compounds the problem. Also sleep apnea. A lot of times people snore. How many of you snore here? I don't. I'm just raising hand. Okay. Have you ever heard this saying that says, he's such a wonderful man, he passed away peacefully in his sleep? Have you ever heard that? Yes. But if that man were to be obese and snoring, he did not pass away peacefully. Obesity hypoventilation syndrome or sleep apnea means you did not get enough oxygen in the night while you're sleeping. Oxygen percent is supposed to be 96 to 100%. It is down to 60 to 70%. Your heart was working overtime to pump the blood enough to get you the oxygen to your brain everywhere else. So the poor heart worked so hard, suddenly one night it said, forget it, I'm done. Right? So that man didn't die peacefully. It was a very painful death. Right? Also, previously one of the speakers mentioned about urinary incontinence. It's a very common thing, and socially it is difficult to admit to many people. You sneeze real hard, you got a problem. You laugh real hard, you have a problem. Right? So this is something is also we are seeing with obese elderly citizens. And depression, that was also talked about by many speakers here today. We see that pretty frequently. And metabolic rate. Did you know that as you grow older, you spend less? Not money, energy. Right? So about 165 kilocalories per decade. That means every day what you spend, about 1600 to 1800 kilocalories based on your physical activity level. Now you're spending 165 less. That means 165 is getting stored in your body without getting burnt. Now, did you guys know that you have to run on a treadmill at 6 kilometers per hour speed for 1 hour to burn 250 kilocalories? You have to work that much. That means every day you have to do that 1 extra hour to burn that amount of calories that is not being spent because of your reduced metabolic rate just by being elderly. Okay? So something that you guys have to think about and be watchful about that. So it is less forgiving in men and more forgiving in women. So obviously women tend to burn a little bit more. So again, this is primarily because of reduced physical activity. A lot of people say that, okay, I'm 50 plus, I'm done, I've earned my money, my children are educated, they got the job, my daughter is married, I have nothing else to do. Suddenly they fall into this old age mode, right? That is not right. Life just begins. Now all your responsibilities are done. Now all you have to do is travel, have fun, take your wife out or husband out, have a good time, right? Plan for future. But second thing you need to look at is the muscle mass. A lot of times you notice that in elderly people that the skin is sagging and the muscle...
You have 2 minutes to go.
Wow. I may not be able to cover everything, but let me just try, okay?
Please.
Yes. The muscle mass comes down so that the physical activity level comes down and the skin sags. All these things are lack of muscle mass. So it is called sarcopenic obesity, meaning you have less muscle in the body and more fat, right? That is more dangerous in here. Also, there's a lot of inflammation that happens and endocrine changes that are happening in your system that lead to further issues with aging. But that also gives you an opportunity for a lot of investigators and scientists where they can work on these areas where there can be a bunch of therapeutic targets. Hopefully some more future investigations come into that and they can come up with some new medications. So certainly the focus of treatment should be in reducing abdominal fat, increasing the muscle mass, right? So we have routine things. Everybody says diet, exercise, and we have other methodology also. Obviously, when you do diets, reduce the calories. Do not take insensible calories. Reduce the fat, control the carbohydrate, take more protein, and exercise. Physical activity does help. It helps you control your hypertension, your mental stress, reduce the depression, gives you all the positive effects. Exercise for about 20-30 minutes a day. That's more than enough. So there are other methods for people who cannot exercise. One is called FIR sauna. It's the far infrared rays. It enhances your metabolism. This is for people like me who don't have time or rather not exercise. And thermotherapy also can reduce the body fat in different areas of the system. Again, these are all the non-surgical, non-painless procedures can be done in the clinics. There are a bunch of bariatric procedures we do. That's my core specialty. We offer different surgeries for morbidly obese patients. I'll show you one of the videos here. This is the gastric sleeve. So it's great. I point the finger, it starts. So basically it's all laparoscopic, tiny little holes, and we place instruments through that. Once we take a look inside, ones who are familiar with anatomy, great. If not, that's a food pipe coming down, stomach and the intestines. Food comes down here naturally. The stomach capacity can be 1.5 to 3 liters. The ones who eat larger capacity have larger stomachs, of course. The top right portion of the stomach is called fundus, which manufactures a hormone called ghrelin. It's a hunger hormone. So in this process, what we do is we reduce the size of the stomach vertically, reduce the capacity of the stomach. At the same time, we remove the portion of the stomach that produces the ghrelin hormone, which is the hunger hormone. So your hunger is down, your interest in eating large quantity, oily food, sweets, fried food goes away. And then your new capacity is that. So once you consume that much of food, you feel absolutely full and satisfied. So typically people lose 30-40 kilos in about 4 months of time. If you see the color is changing to green as it comes down, so the digestion actually begins there. So in this process, we do not disturb the digestion. So there are more procedures, but I'll just skip those. Okay. Certainly there are plenty of benefits in getting weight loss. You know, it can reduce the morbidity from many other conditions that people are suffering from. Increased physical activity definitely is a plus. After weight loss, people can achieve more of physical activity. Like some people want to climb the stairs to a temple. Some people want to be able to sit down, be able to play with their grandchildren. All these things which were impossible or seem impossible today because of obesity may become absolute possibility tomorrow as you lose weight. So let me see if this place. So this is the person, he's a doctor himself, had a surgery about this April. He lost about 50 kilos. Sorry, I had some wonderful testimonials, but the audio is not cooperating here. Okay, we move on. So what it used to be said, an apple a day, is no longer the truth. Okay? So we need to exercise, we need to diet, we need to do all the good things, all the right things just to be healthy. Okay? So just do all the funny things and eat an apple a day? It's not going to work. Right? You have to have active life. Okay? Think about it. So you can be healthy and happy, do the right, take the right decision, have the right lifestyle, and it's just simple. Keep it simple. Okay? So let's have fun and be healthy. So eat well, live well. Thank you very much.
Thank you, Dr. Nandakishore. I think I say always two things. We spend money on eating and we spend money to get the bariatric surgery. Instead of that, eat less and then be healthy and happy. Don't go into that. Yes. One or two questions, please. Only question. Yeah, please.
Hi. Thanks for the lovely talk. I'm Dominic Benjamin, consultant geriatrician, trained in the West. Interesting to see that bariatric surgery is picking up in India. I just wanted 2 questions. One is that before you put a scalpel on anybody, how long do you give trial of lifestyle change, medical management, and what sort of psychological profiling do you do before you put a nice scalpel on the skin?
Okay. So first thing is that every person we counsel, first and foremost, we look at what they have done in the past. Whether they have tried different diets, especially in India, people have a habit of going into many of these places that give you a carrot and a glass of water and tell you to survive, right? So for a month, that is. So these programs they would have tried, and also they would have tried multiple diets, like some commercially available products. I am not at liberty to share the names of the products, but you know, the protein powders and the midnight on TV teas and different kind of products, right? All these things the people would have tried, and some physical exercise and crash diets and non-veg completely out and fruits only, liquid only diet. They would have tried all this. If we take the history, if they have not tried anything till date, then we do put them on a program to see how successful they are based on their body mass index. If the body mass index is already 40 plus, that means they're already 30-40 kilos excess in weight. Now, it is almost inhuman for them or difficult for them to reduce the 30-40 kilos by conservative methods. We know that by experience. Once they have reached the morbid obesity level, then we have less threshold to offer surgery. Whereas if someone is coming with moderate or severe obesity with body mass index less than 37, 33, 35, something like that, then we always put them on a medical program to see if they can cut down their excess weight with that thing. The time tenure, typically we see about 2 to 3 months. We don't do 6 months the way we used to practice in US. At the same time, psychological profiling is very important for us, especially we have certain innocuous questions that will raise red flags to us based on their food habits, bulimia, anorexia, and also some binge eating habits. These are the kind of, and depression, comfort eating. We notice all these factors. We do an evaluation called MMPI, psychological evaluation, to see if they're ready for the surgery and the post-surgical adjustment. These are done standard basis. We are actually the only international center of excellence in bariatric surgery in AP, Andhra Pradesh. So we follow all these guidelines that are provided to us by NIH as well as SRC, and also we follow a bunch of guidelines from ACS. So everything is instituted appropriately. But yes, certainly there's a little less threshold to offer surgery compared to US practice here in India.
Is there any maximum weight you take it up for them? Or to refuse the surgery, Doctor
Where, which side? Oh, I'm sorry.
I'm asking you. Is there any weight limit for you to do the bariatric surgery, or any weight you can take it up?
Well, maximum I can take up any weight.
Is that?
So yes, minimum I'm talking about. I will not take up somebody if they're just about less than 25 kilo overweight. I will not take them up.
See, there was recently we had a patient of 120 kilos. She couldn't walk also, she was in the bed. I tried all hospitals in Bangalore to take her up for bariatric, but they said no. This is because they had to get a CT, it seems, and she couldn't fit into any of the machines which are available in Bangalore city. So I had to send her home. I was helpless.
When I was practicing in US, in New York, we had a patient who was 800 pounds.
Yeah.
We couldn't do the CT scan on him also.
Yeah.
We had to send him to Bronx Zoo, where they scan the elephants. So that's actual reality. Well, it sounds funny, it's actual reality.
That's what, I went to Pillar to Post requesting, because she was a poor lady also. I thought I would help her in some way, but it couldn't happen because no CT machine available in Bangalore she could fit into. Without CT, our bariatric surgeon said no, it is dangerous. Without knowing what is in, we didn't put a knife on her. So ultimately, keeping her for 15 to 20 days with me, I had to send her back. That's the situations we do come across. I don't think we need to go to that extent. We have to take care of ourselves. Thank you very much, Doctor.
Thank you, ma'am,
for your nice lecture on obesity.
Cost.
It's be a lot. 1 lakh.
It's a burning question, isn't it?
1 lakh.
Burns the
you
pocket.
have to burn your money also equally.
That's right.
To burn your fat, you have to equal amount of money you have to burn. Please remember that.
Yeah. Yes, yes, of course. There are 5 different procedures we offer today. I'll give you in order. Gastric balloon. It's 1.35 lakhs is what we offer. Gastric sleeve and gastric band are in the order of 2.5. Gastric bypass is in the order of 3 plus. Gastric plication in the order of 2 and change. I can't hear you, I'm sorry.
Okay.
Okay. I'm glad. I share your opinion on that. Okay, thank you all. You've been a great crowd. Thank you. Bye.
Thanks a lot again.
Thank you, sir. We'd like to thank Dr. Nandakishore Dukkipati, pediatric surgeon, Livlife Hospitals, Hyderabad, for sharing his time with us this evening. Thank you so much once again. Let's give him a big round of applause. He's been a wonderful speaker.
But as